This is Aaron Rand and Natasha Hall on the iHeartRadio Talk Network.
Welcome back. We've been talking about this all day. All media outlets have been talking about this across Canada, of course, the U.S. Last night, 24-year-old Buffalo Bills player Damar Hamlin suffered cardiac arrest on the field in a game against the Cincinnati Bengals. Medics performed CPR for 9 minutes. His heartbeat was restored, and he was transferred to the UC Medical Center. Hamlin is now under sedation and in critical condition. To discuss this horrific incident, I'm joined by Dr. Christopher Labos, cardiologist with a degree in epidemiology, who can be heard on Sunday mornings on CJAD 800s, on weekends with Ken. Dr. Labos, thank you for making the time this afternoon.
Oh, my pleasure. Thank you for having me.
So I heard you this morning on with Ken. We haven't learned much more, but first of all, since this morning, I mean, what do you think the situation is right now? And I'm asking this knowing that we don't have the full information, full portrait right now.
Right, exactly. Now, here's the thing. The initial event, which was the cardiac arrest that happened on the football field, that aspect of it is essentially over. The minute you apply a defibrillator and shock somebody's heart to put it back into a normal rhythm, the cardiac issue terminates, right? I mean, assuming they don't have a recurrence of the arrhythmia, and there's no reason why he should, if it was indeed a consequence of the blow to the chest during the tackle, which seems like the most likely explanation at this point. So the cardiac issue is essentially done. What's probably happening now at the hospital is neurological monitoring, because the problem that happens when you go into cardiac arrest is that when your heart stops beating, you stop pushing blood to the rest of your body. And if the blood doesn't go to your essential organs, and especially your brain, you can't deliver oxygen to your organs and your brain. And without oxygen, tissue starts to die. So the question whenever somebody goes into cardiac arrest, did they not have a pulse for long enough that they started to have neurological damage? And so what might be happening at the hospital now is neurological monitoring. Maybe they're implementing a cooling protocol that has been tried in the past, where you lower somebody's body temperature to try to preserve as much neurological function as possible. So it's the most likely explanation, given that we haven't heard anything new, is that they are doing something like this. They're doing neurological monitoring and maybe doing a cooling protocol to try to preserve his neurological status as much as possible.
So you talked about this morning. What is the most likely scenario about what actually happened last night?
The most likely scenario is that it was what's called commotio cordis, so basically an arrhythmia triggered by a blow to the chest, right over the chest wall where the heart is, at the key moment when the heart is starting to repolarize. And that type of blow, if it's of sufficient velocity, can trigger the heart to have an arrhythmia if you hit it in that very, very narrow window of time. Now, it's certainly possible that there were alternative explanations. Perhaps he had a pre-existing heart condition that was undiagnosed. I mean, those things are always possible. But you would expect that these types of things would get picked up.
Yeah.
But, I mean, it's always possible that somebody has something that's undiagnosed. When an athlete actually has a sudden cardiac event like this during gameplay, the usual diagnosis is hypertrophic cardiomyopathy, and we see this a lot with basketball players.
Yeah.
When they have extreme stress meaning that their heart rate goes up because they're playing the game, they can develop an arrhythmia that way. In this particular context, the fact that it happened right after he tackled the other player and got the blow to his chest, that makes the commotio cordis maybe a little bit more likely.
More likely. And of course, we're not, we're speculating because we don't have any more information. I mean, they're not letting any information out, and that's fair. My next question goes back, because you're a cardiologist, you're a doctor, but there's also a human component here at play. And I was wondering, the reaction. I mean, this is not the first time. I mean, we saw it even last year. There was a professional soccer player that had a heart-related incident. There've been players, you mentioned basketball, there have been basketball players that have fallen and even died following cardiac incidents like this. But this time, something seems to be different. I mean, from your perspective, Dr. Labos, I mean, why do you think we're having all collectively this reaction? Because for example, we didn't call you every time there was an athlete with a heart problem, on the field. This seems different. Why is that, do you think?
Well, I think it was more shocking. I think a lot of people saw it live, which is usually not the case. When a lot of these events happen, they tend to happen in younger people. I mean, he's obviously a very young man.
24 years old, yeah.
Yeah, but that is actually older than average for these types of events. When these things do happen, especially with the basketball players, you're usually talking about college basketball players. The average age for commotio cordis, this type of thing where the trauma causes the arrhythmia, the average age is 15.
Wow.
So it tends to happen in much younger people, which is, of course, even more of a tragedy if you want to look at it that way. But it rarely occurs at the professional level, and it's rarely televised. So while we're aware of it, very few people actually see it. I mean, a lot of people saw this live on Monday Night Football, and I think that's what shocked people, the fact that it then interrupted the game and nobody knew what was going on. And so, it's one thing to know something is true. It's another thing to see it in front of you. And so seeing it in front of you is, I think, what was very, very shocking to a lot of people.
Yeah, absolutely. And so, and in your practice, or generally speaking, I mean, how common are cardiac events, or cardiac issues of that level amongst athletes? I mean, is something more common than we think?
Well, it's certainly not rare, but I wouldn't call it common either. Now, since the United States has started tracking diagnoses of commotio cordis from 96 or so, when they first implemented the registry, there have been fewer than 300 cases over the span of, a little bit under 30 years. So you're talking about 10 to a dozen cases per year in the entire United States. So in Canada, I mean, we see, a fraction of that. So it's by no means something that happens a lot. But you have to be aware of it. Now, the one thing that has really made a difference in this, when you look back at how things were 30 years ago, the survival rate from commotio cordis and from hypertrophic cardiomyopathy and a lot of these sudden cardiac events during sports, the prognosis has improved and improved quite substantially because defibrillators are now more widely available in sports venues. Because when you're having an arrhythmia, the thing that ends the arrhythmia, the thing that essentially saves your life, is how quickly can somebody apply a defibrillator and give you a shock. So in the era before defibrillators were widely available, frankly, most people died. But now, if you have trained personnel there and you have a defibrillator and you have somebody who knows how to use it, you may come out of this okay. The survival rate of this has improved substantially. The quoted number now for commotio cordis is 58%, which is a lot better than it used to be. So, if we can train people in CPR techniques and the proper use of defibrillators, which is the more important aspect of it, and we have defibrillators available in public spaces, we can prevent the negative consequences of a lot of these events.
Well, there you have it. Dr. Labos, once again, thank you so much.
My pleasure. You take care.
You too. Dr. Christopher Labos, cardiologist with a degree in epidemiology, who can be heard at 8:10 on Sunday mornings on CJAD 800, on Weekends with Ken.
You're listening to Aaron Rand and Natasha Hall on the iHeartRadio Talk Network.